And I know after hearing you speak, there's going to be a lot of people that want to work with people like you. And now you're a chief medical officer of Omniscia Health and advisor to multiple healthcare startups. And I would love to ask some basic questions for really targeted from the people that you work with. What is the role of a chief medical officer or advisor in a digital health startup?
Yeah, no, I think that's a great question. I mean, basically, it's someone there who has some experience in healthcare. It doesn't have to be a physician. It certainly can be a nurse. It can be a psychologist,
Hmm.
someone that has the right amount of expertise for the type of work that you're doing, or has a broad expertise and understanding of how healthcare works and how the healthcare system works. That basically tries to be embedded within your company and help guide the process and help set you kind of set you on that path that kind of follows some of the
Hmm.
values, some of the needs, some of the importance of like quality and safety in healthcare, and helps you make the right decisions from a healthcare mindset. And I think a lot of companies you can get that if you're an early company, you can't afford to pay a CMO. Like in my case at Omniscia, it's one of those things as I was learning, I'm like, okay, well, let's do an equity based, fractional relationship, as we start out, and then you kind of, you can give away I guess you can say you can start by giving away free samples, which is kind of what equity
Right.
is when
Or
for an early
in
stage
kind.
company.
Yes, in
If
kind.
you
Yep.
if you get into later stage companies and it's often harder for very early stage companies to actually pay the types of salaries that physicians require with all their loans and training and mortgage and it's kind of a different lifestyle and a different thing that you're set up and locked into. So it's a little harder for very early stage companies to bring on CMOs that aren't like working as a clinician or working as a doctor. Ultimately, you have to kind of do it fractionally or do other
Right.
things, or you have to put together multiple different pieces where you're getting little pieces of the pie. And if you ever talk to Arlen Myers and go to
Hmm.
his CMO school, he's an ENT surgeon out of, I think, Colorado, but he's big in the physician entrepreneur space. And does a lot of
Okay.
like coaching and mentoring and kind of tells us, hey, it's like, hey, this world is different. It's really hard. You can't expect to like go to some like early seed stage startup and say, oh, just pay me $200,000 to be your CM. It just doesn't work like that. You may not have the resources, but you can advise and give advice and guide product development when you're early on, and figure out ways to do that to help a great idea really be molded into a safe idea that is going to work in
Right.
clinical spaces, and then set a pathway to like, hey, here's how you clinically validate a product. We either want to do a QI project, or maybe we do want to do a randomized controlled trial at a particular clinical institution. And by the way, I know people at this institution. Let me help bring it in and bring a little credibility.
Right.
So I think at the end of the day, it's about CMOs are about credibility in the healthcare space.
Hmm.
And a lot of times people are going to choose to do that later on. But if you're not getting a CMO early in the process for designing a digital healthcare product, you should certainly get a lot of advice and talk to a lot of people beforehand. And then if you're trying to make a digital health product and you think because everything about the space because of your personal experience, I would just take caution. It's like, people's experiences are very unique, and you have to design a product that you want to sell to many people that fits a broad range of experiences. And you may have this really passionate story about an N of one or yourself
Right.
or what your family went through or something, but that may not translate to the rest of the world, right? And so sometimes people, clinicians or physicians or nurses or whatever have seen like 20,000 examples, right? So they may be able to help you level set as you're coming up with a
Yep.
product. But those people also, the CMO has to be open-minded and
Hmm.
be willing to meet people halfway and think about things in a different way while also being safe, right? Because if you have someone that's like, we're only going to do things one way and we won't change, that's the wrong type of person to try to become a CMO of a digital health startup, right? So you have to choose someone that's open-minded, willing to work with you and negotiate, but bring balance, like get something that works, but also drive the bleeding edge of innovation and take some risk.